I now invite Dr. Rakesh Gupta. He is President and Director of Public Health, SIPHER. He is a former DHS and Director of Chemical Examiner Lab, Punjab, also alumni of Johns Hopkins School of Public Health, Baltimore, and University of California, San Francisco as a scholar. So Dr. Rakesh Gupta has been the organizer of 5th NCTOH along with other colleagues at PGI. Also, he has been very vocal and has led several initiatives, not only at the central level, but also at the state level. And sir, we would like to invite you, and we would particularly want you to focus on what have been some of the state government efforts to curb tobacco industry interference, and what have been some of those successes. If you can let us know in the next 7 minutes. Thank you, sir.
Yeah, thank you, Monica, and thank you, chairs. Since I have been an implementer as a state program officer, and then later as Deputy Director NCDs. And I would like to put on record the contribution of Madam Vinay Mahajan, who was then Principal Secretary Health Family Welfare, and now she is Chief Secretary, and Mr. Hussain Lal, who is now Principal Secretary Health, and that time he was MD NHM and Commissioner FDA. So all the initiatives of Punjab, they have been undertaken, most of them under their stewardship. So I'll just like to tell you that officials of various state governments at various levels have been approached by representatives of the tobacco industry for easing the implementation of COTPA and withdrawing the certain notification to tackle the tobacco and nicotine menace. And it must be happening with all other states also. And when we banned Gutka, so they approached all the political leaders and the administrators to revoke that ban. And that happened in 2012. So we were among the first state who banned the Gutka. And they submitted all the supporting documents to prove that while SLT should not be banned, as smoking tobacco is more harmful than SLT. They approached all kind of people who were influential. But lucky for us that the political leadership and the administrators, they did not succumb to their pressure, and it stayed. Rather, we bettered upon that notification and we banned even the flavored and scented tobacco a year after that. So they tried to revoke that ban also, and they are still trying to pursue at the highest level so that it can be done. But I think till date they have not been successful. So it is a very interesting actually case study that for the Punjab, the increasing taxes on all tobacco products across board. So they offered big investments to ensure that VAT is not increased. So nationally, we all know that every 10% increase in cigarette prices reduces youth smoking by about 7%, and the total cigarette consumption that decreases by 4%. So we had a national consultation which was organized by WHO Country Office for India along with the Ministry of Health. And immediately after attending that meeting, we put up a file for the Principal Secretary Health to increase the VAT. This was held in 2012, December 2012. And in March 2013, FM announced raised VAT on cigarettes from 20% to directly 50%. And in addition, there was 10% of the cess. So there was, as expected, there was a huge hue and cry by tobacco industry. And they also, the ITC promised 680 crore investment in food park, Kapurthala, to entice the government. In January 2014, the cabinet decided to reverse the decision. And again in February 2014, NGOs asked governments not to roll back tax on tobacco products. And year after, it was increased from 20 to 30%. So in 2016, the Punjab government's finance department has assured that value-added tax on tobacco products, including BD and cigarette, would be increased, but actually it never happened. So as you see, the ITC, initially they offered 680 crore, then they offered 1400 crore, and then they offered 1,700 crores as investment in the food park, so that the VAT can be ruled out, rolled out. So after that, we saw that something else needs to be done. So we requested our Principal Secretary Health to constitute an empowered committee to implement Article 5.3 of FCTC. This happened immediately after the union organized a workshop for this FCTC 5.3. And maybe within 2 months of that workshop, we moved that file. So another instance is the revoking the ban on ants. So as everybody knows that Punjab was the first one to ban ants in 2013. So when not many people, they actually knew what e-cigarettes are. And we also know that all the e-cigarette brands are being promoted by tobacco industry. So when we banned, I mean the state government that banned ants under the Drug and Cosmetic Act. So the tobacco industry people who were manufacturing electronic cigarettes as well, they came running to Principal Secretary Health and to convince that it is a very good product for cessation and the ban should be revoked. But she did not succumb to the pressure, and even rather we provided technical support to 17 more states to ban the ants before the government that introduced that bill regarding ban on ants. So as a result of firm decision taken by the government of Punjab, no electronic cigarettes were available in the POS or even on e-cigarette commerce sites since 2014. And so this is a starter pack of e-cigarettes. We got this sample from the manufacturers. This is the warning on the pack. And there was another tobacco industry interference when we banned loose cigarettes. So tobacco industry, they provoked tobacco wholesalers and vendors to agitate against the decision. And when the ban was not revoked, they introduced single and double cigarette packs. But we then asked Legal Metrology Act department to do something about it and to declare packs of less than 10 cigarettes as illegal. Though Legal Metrology department, they are helping us a lot in tobacco control, but this has not happened actually. So tobacco farmers, they sent representation to the government, all state governments regarding these issues. A letter was issued to the CBSE regarding non-participation in events sponsored by tobacco industry. So the Punjab government, they kept on doing some issuing some notification or circular so that the tobacco industry can be somehow stopped from interfering. And then 2015, we had a notification regarding the empowered committee for implementing FCTC 5.3. So in the empowered committee, it was formed under the stewardship of Principal Secretary Health, under the chairpersonship, and Principal Secretary Home, Financial Commissioner Taxation, Secretary Health Commissioner FDA, Secretary Public Relations, and DHS. They were other members of the committee, and CFDA was a designated special officer. And I must say that after the constitution of the committee and after sensitizing all the MLAs, all the administrators regarding the constitution of committee, there has never been much tobacco industry interference. So this has helped us a lot. And the protocol, actually, some part of it has been covered by Dr. Swasti. So protocol to be followed by dealing with the tobacco industry was the public officials and employees, they shall limit their interactions with the tobacco industry. And even that a meeting is strictly necessary, there should be a set meeting agenda and the discussion should be held in writing. And we should clarify the goal and structure. And it must be made clear that such interaction does not imply partnership, dialogue, or collaboration by the tobacco industry. So, and we made sure that any meeting, if required to be held, it should be held in the premises of the department, institution, agency, or the local government. And the photographs taken for the meeting should strictly be for documentation and should not be used by the tobacco industry for public relation activities. And we also ensured that predetermine the meeting participants. Moderation of the meeting was made necessary. A lawyer must be present and must closely advise the official employee representatives during the meeting. And we also made sure that official minutes of meeting should be recorded, voice recording, and also in a written form.
So would you
And
be
we
able
also
to
reserve the right to terminate the meeting at any point. So publicly correct any information regarding the meeting if required. And we also decided on following up questions that must be answered after the meeting, and all non-mediated exchanges. So we made sure that should be avoided. So, and the protocol as said by Dr. Swasti. So we strictly followed that protocol, and it was in black and white. And Dr. Monica, if time permits, I can, give some instances.
So we
Or
can
is it
come
okay?
back to it. We'll just finish
Okay,
the
okay,
first round.
okay, okay. Thanks a lot. Thank
Thank
you.
you